Introducing the Chesapeake Cervical Titanium Stabilization System from K2M, Complex Spine Innovations. The Chesapeake Cervical Titanium Stabilization System is a multi-screw construct providing stability to the anterior column while reducing the need for supplemental fixation in the cervical spine. Featuring the revolutionary tifix locking technology, the system exemplifies advances in new and innovative instrumentation and technology required to achieve fusion. The Chesapeake Cervical Titanium set is designed to facilitate a direct anterior cervical surgical approach. Perform a standard incision and exposure of the ventral cervical spine, then complete a standard discectomy. To determine the size of the interbody, utilize the trials which are available in 7 degrees of lordosis. Trials are undersized by 0.5 millimeters to allow for a slight press fit of the respective implant. If the trial appears to be too small, gradually increase the height until a secure fit is achieved. Chesapeake Cervical Titanium implants are available in 12 by 17 millimeter and 13 by 18 millimeter footprints in heights ranging from 5 to 10 millimeters in 1 millimeter increments. Each interbody is designed with 7 degrees of lordosis and is color-coded by height for ease of identification. Choose the drill guide inserter of the corresponding interbody height. Insert the inner shaft through the proximal end of the drill guide inserter and rotate clockwise 1 to 2 turns to engage the thread. Load the interbody onto the drill guide inserter, making sure to match up the markings for correct screw orientation. Turn the inner shaft thumb wheel on the proximal end in a clockwise direction to secure the implant. The drill guide inserter has 2 barrels that are fixed at a 40-degree trajectory and accommodate the awl, drill, tap, and drivers. A single-barrel drill guide is also available if desired for use with the single-barrel drill. Alternatively, if countersinking the interbody is desired, the adjustable stop inserter may be used. Once the interbody is properly positioned, screw preparation may be performed using a variety of awls, drills, and taps through the drill guide inserter. All are available in both fixed and universal options. An awl may be used to aid in creating initial pilot holes. Next, a drill may be used to continue screw preparation. 3.5 millimeter and 3.85 millimeter diameter screws are available in 12, 14, 16, and 18 millimeter lengths. All screws are color-coded by length for ease of identification. The screws are self-tapping, however, the tap may be used prior to screw insertion. Once proper screw preparation has been completed, attach the selected screw to the size 10 tapered driver. Tapered drivers are indicated by 2 magenta rings around the proximal end of the instrument shaft. Insert the screw through the drill guide inserter. Once all screws have been inserted and proper screw positioning has been verified via intraoperative radiographs, the final screw locking can occur using the non-tapered driver attached to the torque limiting handle. Non-tapered drivers are indicated by 1 magenta ring around the proximal end of the instrument shaft. When the screw head engages on the locking lip of the tifix, the revolutionary tifix locking technology will commence. Due to a difference in material hardness and design, the screw head begins to deform the tifix through a reshaping process and thus forms an autogenic lock. The torque limiting handle emits an audible click at 12 inch-pounds to indicate that the autogenic lock has formed. Use of the torque limiting handle further assures that the screw is not over-tightened. No additional locking step is required. If realignment of the screws is desired after final locking, the screws may be locked and unlocked up to 3 times without compromising the locking mechanism. When the construct is complete, perform a standard multi-layer wound closure. The Chesapeake Cervical Titanium Stabilization System from K2M, Complex Spine Innovations.